Hey guys, Dr. Grizz at 918 Chiropractic, and I'm going to talk to you about what I do. Sounds like it would be a pretty pertinent topic. Yes, we adjust people, and sometimes their spines make noises and pops and cracks, but what's happening? What does a chiropractor do? What do I do for a living? What does Dr. John in the South Tulsa office do for a living? Why does your chiropractor do what he does? Okay, this is the spinal segment. In between the spinal segment, there is a disc. The disc is fluid filled, that's the center. And the outside is cartilage. This is very much like a jelly donut, right? Strawberry jelly is my favorite, just heads up. Long story short, what happens in a normal spinal segment is that it should have motion. It should move. If it has motion and it moves, it rehydrates this disc. It keeps all the fluid healthy and happy into the disc. What a chiropractor does is unlock a joint so that it allows motion to that disc. Follow me here. If there's no motion in the disc for a long period of time, what happens is the disc begins to decay. It begins to dry out. What specifically is happening is there's no new fluid. How does that happen? Well, it happens like this. It's called a subluxation, less than normal motion in the spinal joint. It gets fixated. You can hear it, right? It gets fixated, it gets dried out, and no fluid gets in it. We're from Oklahoma. We practice in Oklahoma. In Oklahoma, you'll see, I'm from Arkansas, definitely in Arkansas, you'll see a lot of old rusty cars out in the field. What happens? You put that car out in the field, it begins to rust. Why? It didn't move. Human body, very much the same concept, okay? These segments got locked. The disc began to decay and dry out. So what do? My job is to come in and apply an adjustment. Unlocking the spine. When I unlock the spine, it allows free motion of the segment, which gets fluid into the disc. When we have fluid into the disc, it's happy. It has nice cushioning to support the yellow thing called the nerve. Nothing matters as long as it doesn't hit the nerve. We don't want that hitting the nerve. And so when you've heard of a herniation in a disc, it's when it's gotten stuck for so long, it squishes out. You can see where that squished out and or herniated. If it does that bad enough, it'll hit a nerve. This happens because of lack of motion in the spine. Let me repeat. If the spine does not move, these are the predispositions for that. Does this make sense? In other words, spinal arthritis typically happens in certain segments, L4, L5, L3, L4, L5, but it's nothing to do with how old you are. Okay? It doesn't mean that you're 86 years old that your whole spine has to look like this. What it means is at one place or point, a trauma happened, something happened to the patient, the spine got locked, it stayed there for a long period of time, that disc decayed. I see patients every single day. I see x-rays every single day. The patient's spine is the same age as the patient. However, certain segments can look like they're 80 years old and some can look like they're 20. Why? Lack of motion in the spine. So if you don't know what a chiropractor does, this is a great quick tip video, easy peasy. I think I broke it down really nicely. As you go through, what we're doing is unlocking the spine so that the disc is happy. If the disc is happy, it takes pressure off the nerve, and wherever that nerve goes, you get better. Could go to your GI tract, could go down your leg, could go to your head. I don't know, could go anywhere. You function better when your spine is working like it's supposed to. 101 Chiropractic 101 right here. Dr. Grizz at 918 Chiropractic.